We're going to continue the next half of our discussion, and we're going to be focusing on kids. There is nothing worse as a parent to have a sick child and you can't solve the problem yourself at home and you're thinking about going into the hospital, and you know it's got to be really bad and you're really worried. And now you're going into the hospital during COVID-19 and you need to be there with your child. What's the situation? Am I going to be able to get a specialist? Because obviously working on a child is a lot different than working on an adult, and you need people who know how to work on little people when they're sick. So the pediatric emergency department is so crucial at GBMC and so important for the families in this area. And that's kind of what we want to focus on next. How has that changed? What will it be like if you have to go there with one or both of your children or many of your children? Who knows? Let's hope not. But if you do, we want to know that it's there and how it's functioning. And so joining us now is Lauren Rogers with GBMC, who is a nurse at the Pediatric Emergency Department, talking about the new Pediatric Emergency Department. And Lauren, thank you so much for being with us.
Thanks for having me today. So as far as the Pediatric Emergency Department goes, the patient will arrive in the emergency room. They will check in and be registered. They'll pop up on our track board that we have in the back and be taken into a triage room. Most of the time, the adult nurse, they're very helpful. We have our own designated triage room for sometimes the patient can't be brought back right away, so we still try to provide that care as soon as possible, get the patient's vital signs, get their temperature, and kind of go through like a brief medical history, surgical history, and medications with the patient. And sometimes we'll have a room open in the back and be able to bring them right back to the pediatric emergency room and triage them right in the room. And this is one of our inpatient rooms They are all new and beautifully painted to make it somewhat exciting for the child. We try to do some bright colors as like welcoming and comforting for the children, because it's scary for them to come to emergency room and see all this different equipment. So this is our new updated pediatric emergency room. We did a purple. If you look up at the lights, we have a little bumblebee up there, and most of the rooms have different things on them. One of the room has little kitty cats. The other has like a tractor. So just to try to make it fun for the children and kind of comforting.
Yeah, they're not the only ones who are scared, by the way. The parents are probably a little freaked out too.
I know, I think we're all.
Yeah, it's hard when involving a child. And we, especially if you have a child who can't communicate what's happening, actually.
Absolutely.
I have been fortunate enough to be at the GBMC Pediatric Emergency Department with my daughter when she was very young and she had pneumonia. And it was amazing, the care, the amount of concern immediately right out of the gate, the separation between adult and children in the emergency department. It did instill in me a great deal of confidence and comfort at the care she was receiving and did receive. So it's nice to see it all spruced up. It looks really shiny.
Yes,
but now,
of course,
now of course with COVID, if I'm a mom or a dad and I'm coming with my child, you're not going to separate us, right? I mean.
Correct. So what we do is we do have, with the new updated waiting area, there is like a different wall and a separate area that for pediatrics that the parent and the child can sit. There's like little tables with like some small chairs and Disney Channel or cartoons on the TV where the parent and the child can wait to separate the adults from the ped side. So we ask that all the other little children that aren't being seen stay home just for safety reasons and due to the COVID-19 pandemic. We do allow 2 parent guardians present upon the child's visit, so both parents can come back.
Okay. And does that mean both parents or 2 adults, or it just depends on the situation? I would imagine you have to make the call depending on the unique family situation in the moment, right?
Yep. So 2 guardians, can come back mom, dad, and uncle who is ever caring for the patient, but 2 adults, and the patient can come back to the room. As far as the inpatient rooms, 2 adults as well. Things are always subject to change, being that we are in this current pandemic, but we ask that any other little children that aren't being seen or sick to kind of stay home to protect themselves.
As a parent right now, I think that we are probably more inclined not to come to the emergency department if we don't have to. But what are the things that you want to make sure that parents know that they should not wait for? What are some symptoms, some signs at home that say you need to get in?
Absolutely, yes. So any children experiencing any respiratory distress, breathing, any kind of like abnormal breathing. So like if their belly, like sucking in between their ribs, any throat, if their throat's, kind of going in and out, if they're making a noise, definitely bring them into the emergency room. We do always advise parents to call the child's pediatrician first prior to coming to the emergency room. Of course, if the child is having an emergency, absolutely bring your child. Do not hesitate. But sometimes just doing that primary care first and reaching out to your pediatrician can save a trip to the emergency room. But respiratory distress, if the child just kind of looks pale and he's sweating, if they're not acting their normal self. So we definitely bring them in for an emergency reason. As far as like coughing, new onset of fever, in pediatrics, we say a fever is 100.4 degrees and over, at least, 24 hours first of the fever with, appropriate meds, Tylenol, Motrin, definitely giving them a dose to see if that helps lower the fever. And calling their pediatrician in the meantime is also a great idea, but definitely come in for emergent symptoms.
No one's going to make you feel bad for being overly cautious.
Not at all.
What would happen if my child needs to stay overnight? Are there accommodations there for parents?
Yes. So in our pediatrics inpatient rooms, we do have a pull-out couch, and we do have a reclining chair that reclines all the way back. We provide warm blankets, also a fun blanket for the child that we get donated to us, which is kind of welcoming and comforting for the child. But we do provide a place for both parents to sleep, yes.
Are you seeing any changes in the frequency of parents bringing their children to the pediatric emergency department post-COVID?
As far as like frequency, I feel like it's always changing, honestly. We have our weeks where we're getting all the children, and then we have our weeks where, it does kind of wind down. But it's always good too if someone calls, the emergency department. We are also like, should I bring my child in, or how long's the wait? We don't give out any wait times over the phone, but we do say, of course, we recommend you calling your pediatrician. And if they say to come one in, absolutely come one in. But it's definitely varies. It's always changing.
I think we have some shots of you, Lauren, kind of all geared up at work. And there you are, yes. Thumbs up.
Yeah.
How is it for you wearing all that gear, and what kinds of changes have you made over all these months to make it maybe more comfortable for you, safer for you, easier to manage?
Yes, great question. So we have to wear a N95, of course, entering any patient's room, our gown, gloves, and goggles and face shield. So definitely the N95, it's hard. At first, I really had to learn how to control my breathing because I would feel like, I was just breathing in all my air. It was really a process to learn how to breathe in it and to be comfortable with keeping it on for longer hours. As far as our face shields go, we have wonderful child life specialists. One of our child life specialists will be talking next, but they have a Cricut machine and they print out these fun stickers so we can make them child friendly. A lot of people like the little donuts. We made Halloween wins. We're going to do Christmas wins just to try to make it fun. As far as our head wraps go, we had a bunch of donations from people and nurses, of other nurses, friends and family members make us some wonderful head wraps and fun masks for the children also.
Speaking of that, there may come a time where you may need some more items like that. Are there certain donations that you would like to see people give, or have people been asking you still about what they can do to help?
Yeah, so actually we're very fortunate to have, wonderful people to supply these items for us. Of course, we're always in need of masks, children's masks. We are getting some more donations for children's masks, but it's fun for them to be provided with, a fun mask. But definitely mask, head wraps, even the nice headbands with the buttons on them are really nice too, to help hold the mask from rubbing against the back of our ears is really, really helpful. But we appreciate all the donations we've gotten so far. It's been awesome. It's been very nice.
Yeah, and I guess if you want to make a donation, if you're watching this right now, you can go to gbmc.org/donations to find out really specifically what's needed. It also made me think when you were saying that about the children's masks, that if I'm bringing my child to the ER, should I grab up every clean mask I have in my house to bring it just in case?
No, you don't need to grab all the masks, just definitely
Okay.
one mask. And we try to stress the importance that both adults as well entering the ER, everyone has their mask on at all times. Even as nurses and the physicians, kind of entering in and out of the rooms, just having your mask pulled up is awesome. So yes, definitely bring a mask, maybe two, but you don't need to grab all the masks you have.
Is there anything in particular, and I asked this question too of Ariel, in particular that you love about the renovations in the emergency departments? Something that's made life a lot easier. Obviously, it's been good. It tries to get better all the time.
Right.
But there has to be something you say, oh, wow, this is great that we're doing it this way now.
Yeah, so I do want to say having our emergency department and the security right at the desk when you first arrive, and having registration sit right there with the quick look, the triage nurse, and our triage rooms right there has really, really made it easier to kind of get to the patient quicker and kind of get that hands-on care as soon as they come in the door, to get their vital signs, obtain any lab work or specimens that we may need to kind of get the care started. That way, when they come to the back, they are ready to be assessed by the physician and whoever else may need to assess the patient. And we've also gotten a lot of feedback about the pediatric emergency department being, kind of like disconnected from the emergency department, having the little children, the designated children area with the TV, the cartoons, the smaller chairs has been really comforting.
Yeah, it's a completely different mentality. I mean, the process is the same in the end. Obviously, you're helping people get well and saving lives, but the way in which you do it is so completely different when you're talking about children.
Yes, for sure. And the fun colors. We have the children that love the fun colors and that love the little, pictures on the ceiling. So,
as a nurse, has this past 8 months been the most challenging time for you?
Yes, I would say nursing is a challenge in itself, but I love it. And the teamwork here at GBMC between the adult emergency and us is it's great. We are able to, kind of communicate with each other as far as if a critical pediatric patient comes in, the nurse, then calls, hey, something's not right. We're able to get out there as soon as possible and, hopefully have a room open for the patient, just to kind of, as a pediatric nurse, lay eyes on the patient, also helps the parents feel comfortable. But just everyone being able to work together is very, very helpful with teamwork during this time, but it is challenging. Another question we often get asked, I just want to bring this to awareness, is how long wait times are going to be. I cannot stress the importance. Every child matters. Every child is an emergency that walks in through these emergency room doors. We try to get to every patient and assess them as quickly as possible, but wait times are always subject to change. We do get a lot of how much longer is my wait going to be? Well, my child was here first. we definitely try to get, to everybody, but we go based off of priority levels. Sometimes we have an ambulance come in with an emergency. That patient needs to be taken care of immediately. So we do try to, say your child will be coming up next, or try our best to give a little bit of leniency and a wait time, but that always changes based on, different emergencies coming in, whether we get an ambulance or not.
Well, and we can also help a little bit from our end if we get really involved in the My Chart, keep it updated, let you know ahead of time that we're coming if we can, and that way you're prepared.
Yes.
Thank you so much. I mean, if you've reached one parent today, just to hear your words of comfort and confidence in the department, who makes a decision down the road that to come in or not come in, and they do the right thing and come in, then you've done something amazing. So you don't do that every day. So thank you so much for being with us, and thank you for all the work you're doing, particularly during this pandemic.
Thanks so much.